Hello, everyone, and welcome to today's webinar, Breaking Down Barriers in Healthcare, an urgency for the clinical laboratory to move to the forefront of patient care, presented by David Humphreys, Head of Health Policy and Clinical Evidence Practice, EIU Healthcare, The Economist, Washington, D.C., USA. I'm Alexis Krause of LabRoots, and I'll be your moderator for today's event. Today's educational web seminar is presented by LabRoots and brought to you by Abbott. To learn more, please visit abbott.com. Now, let's get started. Before we begin, I would like to remind everyone that this event is interactive. We encourage you to participate by submitting as many questions as you want at any time you want during the presentation. To do so, simply type them into the Ask a Question box and click Send. We'll answer as many questions as we have time for at the end of the presentation. If you have trouble seeing or hearing the presentation, please click on the Support tab found at the top right of the presentation window, or report your problem by clicking on the Ask a Question box located on the far left of your screen. I now present today's speaker, Mr. David Humphreys. For a complete biography on our speaker, please visit the Biography tab at the top of your screen. David, you may now begin your presentation.
Thank you, Alexis, for the introduction and certainly the opportunity to present the results. What I think is a really timely and interesting study, certainly as all aspects of healthcare are under scrutiny in a way that can drive value in the future. The agenda today for the webinar is simply present the results of the study that we've conducted, looking at the state of the clinical laboratory today, its space within the healthcare ecosystem, and what it can be in the future. Before I get into the results of the research that we've done, I want to disclose that this research program and webinar is sponsored by Abbott. I have nothing to disclose. And to give a bit of background on EIU Healthcare. As part of the Economist group, we certainly have the history of looking at issues of intelligence around the world. We are the analytical arm of that group, covering all markets in the world. EIU Healthcare has a great set of capabilities that look at the issues from different perspectives, from a market, from a policy, from an economic, and from a clinical perspective. And value-based healthcare has been one of those topics that we have spent quite a bit of time in analyzing. With that said, before we get into the research results, it's always good to be able to look at the broader context, the forces at play in the world. The graph that you see in this slide is not an unknown story. We understand and certainly are aware of all the pressures from a cost perspective, from a population health need, and how that is impacting and putting a lot of pressure, both from populations, individual patients, and health systems itself. And within that context, the value-based healthcare movement is a good and a positive step in the right direction to generate better results. But it isn't simply a simple equation of outcomes over cost. There's nuance in understanding what outcomes are defined in that cost perspective. With that said, the EIU has developed a framework for understanding and really developing what value-based healthcare means from a policy perspective. And you'll see it referenced throughout the work that we discussed in the laboratory and its place in this world. From an enabling context perspective, looking at issues of HTA existence, the collection of data like cost data or patient registries, integrated care and established care pathways, and incentive systems and moving away from fee-for-service to something that is more directly tied to outcomes itself. And in our work that we've done, you see positive developments that are happening in multiple markets around the world. If that's incentives for those in Sweden to be able to feed into disease registries or collection of cost data in South Korea, or even integrated care policies like those that are developed in Colombia. At the same time, the migration from legacy healthcare systems to those that really focus on the concept of value have a work in progress. Migrating systems like EHRs to those that capture all the data and empower people to make better decisions is certainly, like I said, a work in progress in most markets in the world. And that's why our research seen the development of value-based principles is really at that incipient stage. But this gives us an important framework as we look at the issues, particularly around the laboratory. And as we get into the results of our study, there were really three key themes that we want to be able to highlight. And you'll see these themes throughout the data analysis that we'll present over the next 20 or 30 minutes. The first theme here is that it's very clear that the laboratory plays a secondary role within healthcare. It represents 1% of medical literature when talking about value-based healthcare, 5% of healthcare expenditures, and really a one-way flow of communication between other stakeholders. At the same time, our research, and I think it's a really exciting piece, is that there is a real opportunity, an enabling environment to be able to put the laboratory in a much greater elevated position, to have an impact on the value equation and generate better results for patients, for systems, and for all those that participate in the healthcare ecosystem. That leads to the third point. While the path of the future is not defined, it's very clear that there are two different directions that could be done. One that really elevates the laboratory and puts it in a position that takes advantage of all the knowledge and data and insights that can drive more predictive, better healthcare for everybody involved. Or the system can really impose changes on all those involved. And you'll see how that plays out as we get towards the call to action later on. Now, with this said, I want to give a little bit of context in terms of the research that was conducted, looking at 14 markets, advancing emerging economies around the world, and doing more than 5,000 surveys with healthcare professionals, lab directors, executives within hospitals, talking to payers and key opinion leaders to really understand what is the state of the clinical laboratory within that healthcare ecosystem today, and where can it be in the future? And the second and the fourth question within this slide are really very critical. Those perceptions, correct or incorrect, really drive behavior and the way the system, the flow of information occurs today. And the second level, it's also very clear through the research, and was something a very key point, of what would a lab 2.0, a different level of involvement in healthcare and leveraging all the greater data and insight to drive better healthcare. And you'll see those results as we go through the rest of the webinar. Now, as we start to present those results, it's important that we frame this within the broader perspective. And what you see on the slide here are those same 4 pillars of value-based healthcare and the framework the EIU has developed. And we want to be able to put it within the context of what is the opportunity for the lab to impact and improve upon that value, and what is the real reality, the perception of the lab today. From an enabling environment perspective, education is certainly viewed to be critical, that healthcare professionals, more than half, really desire to receive that regular training. But the reality is less than 20% of lab directors surveyed provide that training today. We hear a lot about measuring results, and we can see in markets like the UK that demand for laboratory testing continues to grow every single year. At the same time, do we feel confident the results point to some issues that a high percentage, a decent percentage of those tests are really necessary and drive incremental value for the system and for the patient. From an integrated care perspective, again, another topic that has been well spoken about, but it's a high percentage of information that allows everybody that participates in healthcare decision-making is not being leveraged, coming from the clinical laboratory, in this case in test appropriateness, then are the right decisions being made at the right time? Lastly, incentives is certainly a critical issue. And this is where you see a difference in beliefs that exist, that executives on one hand really believe the lab to be one of the critical functions in delivering high quality healthcare. But at the same time, if there's no alignment on the KPIs, those key performance indicators, and shooting for the same goals, that's where it generates an imperfect system. All of this has implications that may be very narrow, the $200 billion in wasteful spending in diagnosing treatment that happens in the US. Even if a small portion of that is related to the role the laboratory plays today, that reinvestment can have a great impact on value if we were able to be more efficient in the future. From a broader perspective and looking at needs and being able to predict healthcare needs that populations have in sub-Saharan Africa, by 2030, if the path continues, 50% of patients go undiagnosed for diabetes, which represents an economic burden of $60 billion. But through the right diagnosis and early interventions, you can change that trajectory and really improve upon value in healthcare. Let's dive a little bit deeper into the issue of perceptions and why the situation is as it is for the clinical laboratory in healthcare. Now, before we get into the perceptions, it's important to recognize that part of this is financial, that when in the US, there may be upwards of 700 million less spent in service provided in the clinical laboratory, or in the case of Australia over a period of a decade, that expenditures in pathology have gone from 22% to 12% as overall expenditures in Medicare, or even cases like India where there have been announcements around putting price controls for services related to the laboratory. Financial aspects are certainly very important, but there are broader underlying issues in terms of perceptions or misconceptions that exist that really have an impact on the value equation. Part of that is really being able to see that value, or maybe perceived to be marginal value, of what the clinical laboratory is able to offer. And you can see in the figures here from healthcare professionals where they see the lab as a valuable resource. That's a very small percentage compared to what the reality should be. And the same thing perspective from the executive, and seeing little to no expectation for the lab to provide additional value. Even within the laboratories themselves, expectation to have an impact and important KPIs is really very critical and demonstrates a gap that exists and what that impact may be in the role of clinical laboratory in healthcare. That has an impact and repercussions throughout the system. It means potentially not using the right standards when it comes to selecting and using the appropriate tests for the appropriate patient at the right time. It also has concerns about the experience from a patient perspective, or even healthcare professionals that are looking to take the right and timely decision for patients now and moving forward. While there is many of the trends that we've discussed already cut across all different markets, it's to recognize that there are some differences between the countries. And I want to present some of those results here right now. The first graph that you see here presents from an executive, from a clinical laboratory perspective, what are those most relevant KPIs selected from a list of 20 across clinical and satisfaction and laboratory specific KPIs. And what you see here are a couple of really very critical trends. Some markets like the US, particularly in the executive level, have a high level alignment of what those critical KPIs are for organizations. In the case of Japan, the low percentages, particularly for in-hospital mortality rate and lab critical result communication, those percentages tend to be lower than the global average. The bigger issue here is the difference that exists between the perception of what is a relevant KPI from an executive perspective and from a laboratory perspective. Even the case of the US, a 20 percentage point difference between his in-hospital mortality rate, or in the case of a patient satisfaction, that you have less than half of lab directors consider that to be a critical KPI for the organization overall. At the same time, there was great concern in terms of the utilization of testing that exists. And the figures that you see here represent from a patient perspective the percentage of testing that's occurring today that is perceived to be unnecessary. Now, the trend across geographies is a logical trend that those in emerging markets that have shifted healthcare systems to a focus on access and now moving towards value have a higher level of that perceived unnecessary laboratory testing. At the same time, within the box, from a healthcare professional perspective and from others, from a lab perspective, upwards of 24 to 28% of the global level perceive testing to be unnecessary. And this is an important fact as we move forward, because it's those perceptions that certainly have an impact on behavior. Now, two very critical themes I think we all would agree upon, KP management, data analytics. You start to see some of those underlying issues, particularly impact around perception. On the KPI management side, as I mentioned before, executives believe the laboratories to be one of those top functions in achieving the goals of the organization. But how can that be the case when lab directors, less than half, are actually have a direct involvement in setting those KPIs? What that generates is a misalignment of what goals an organization shares. In this case, you can see labs and executives share only 2 of the top 5, patient satisfaction and number of hospital-acquired infections, as KPIs. More importantly, within each of their segments, it's very clear that the laboratories themselves have a wide range of goals, that only 54% agree on the top 5 prioritized stakeholder KPIs. So shooting for a different set of goals really has an impact on the overall role of clinical laboratory in healthcare today. From a data analytics perspective, it is no surprise to see the expectations from executives to increase abilities in areas related to precision medicine, as an example. But those beliefs don't necessarily match up both with the state of data skills within teams. Healthcare professionals and laboratory directors present a very low percentage in their own skill set that around data. Additionally, even if there's a belief in increasing the abilities around data analytics, the funding is not necessarily aligned to fulfill those needs. And so that difference between the perceptions, the beliefs, and the actions create a lot of issues in terms of misexpectations when it comes to the role of the clinical laboratory, even in the immediate future. Now, as I mentioned before, the perceptions around the globe aren't necessarily the same, and the experience can be. What's interesting is when you break out the experience from the data analytics, you can see in the cases, particularly in the UK, in this graph, there's a high level of expectation and understanding from executives and the capabilities in data analytics. But the reality for labs and healthcare professionals is those skill sets don't match up with the expectations of execs. And to see differences in markets, even in an emerging market like China, where there is a little bit more alignment and what that true reality, where the skills are at, maybe reflects where there's more capacity, understanding, sophistication for data analytics, the greater the gap is. At the same time, we mentioned before, the involvement in KPI setting. What you see here is that perceived lab involvement in KPI setting from the laboratory perspective, from the executives. And you see a quite difference, the remarkable difference in Brazil, of over 40%, where 93% of executives believe the laboratory is involved in KPI setting, whereas just half of laboratory and directors surveyed feel like they're actually involved in that process. And that delta cuts across all of the markets, except for the case in the US, that actually laboratories feel like they're more involved in KPI setting. What that leads to is a misperception is what is the true level of integration into critical care and the impact in KPIs. And the data points that you see in the left and the right demonstrate the expectation of executives. 77% of the surveyed in Brazil believe that the lab is integrated and has an impact on the number of hospital-acquired infections, but only 14% of lab directors have that shared belief. And it's that gap that's actually very critical. Now that we've seen the state of the laboratory, it's important to take the perspective of what could be the future role of the clinical laboratory in the future. And it's helpful to come back to the same framework around value-based healthcare that we introduced early in this webinar. From one perspective, it's very clear that the laboratory has a tremendous amount of data and insight and expertise that can really help drive value in diagnosis. This is going to become much more critical as the complexity of care increases over time. There's multiple areas in which that laboratory can play a role in the value-based healthcare equation. On the right-hand side, you see a number of different examples in driving early diagnosis to be able to interpret and communicate experts' insights, and ultimately be able to predict what may be a population health needs and what is the right type of intervention that drives value both for the patient as well as for the system. Now, the good news from our research, as we frame it within this value-based healthcare perspective, is we saw a great enabling environment of stakeholders that want to be able to leverage the value and insight that the laboratory can bring to the fold. On one hand, from an education perspective, that there's a great willingness from both patients as well as healthcare professionals to leverage proactively laboratory recommendations on what tests to utilize and guidance in trying to understand what those results are. And that's very critical and demonstrates a role that laboratory can play in bridging this path, which is clearly a trend that's going to occur for both patients as well as healthcare professionals at a time when patients, 40% of those surveyed went out and conducted tests around general well-being without the consultation of a doctor, 29% in cancer markers. Patients themselves are going out there and looking for information and need that insight and to be able to understand the results. And the same thing happens for healthcare professionals. We'll talk more in detail a little bit around the measurement of outcomes and costs. The data aspect is very critical. But as you can see the percentage here, the stakeholders really believe the clinical laboratory is the right entity and the right function to help drive and become a repository when it comes to data. From an integrated and patient-focused care, again, you see the trend and where that bridge, as I mentioned before, for the enabling context between patients that are very active in managing their health and healthcare professionals that are trying to understand the myriad of new interventions and technology that are coming to the marketplace and trying to figure out what are the best for their patients and really trying to see new models in which this is developed and communicated in a way that's timely and effective. And certainly outcomes and driving towards the same set of goals is really very critical. And trying to see that alignment when it comes to KPIs and really developing the laboratory as that repository for information. Now, as I mentioned before, the data analytics aspect is one of those starting points, because if 70% of data that's generated comes from the pathology side that really impacts decision making, then how can we enable that data? Certainly, it can be a bridge between stakeholders, I mentioned before, between patients, between providers and healthcare professionals, and even payers who are looking to find the evidence to be able to support one intervention over another, demonstrate that that provides value for a certain patient group versus others that do not. You can see through the graph the expectation that executives have in the future of data management or predictive analytics, the lab playing an increasing role within the space. And it really props up the lab in a way that can enable not just that data, but also that insight in a way that's communicated. And you see loads of examples exist around the world, from the Atlas of Variation in the UK to countries like Vietnam that are really using aggregate data to be able to predict, in this case, define patterns by patient type in the future. And so models exist already today that paint a roadmap of what could be the future of the clinical laboratory. The research really concludes with 4 clear calls to action. And those call to action certainly starts with creating that link between the labs and outcomes by standardizing and measuring those intermediate KPIs. How do you link the KPIs that the labs feel like they control and link that back to the broader KPIs like patient satisfaction and those that are related to the clinical side that organizations focus on. Data is certainly a very critical aspect, and sharing real-time information, making sure that's patient and population specific, and generating new models that are able to drive better decision making for all those involved. Laboratory standards and education is a critical aspect. Again, as we mentioned before, it's a complexity of care that the advances in medical science and computation power allow healthcare to take better decisions. It's an overwhelming amount of information about new learnings that needs to be disseminated in a way that's effective for everybody involved. And that integration of all stakeholders, as I mentioned before, the participation and KPI setting and tracking those goals. So there's a shared common set of purpose that stakeholders share and be able to drive towards. The last point that I would mention here is we need to continue to evolve the definition of value. That value isn't just related specifically to healthcare. For instance, in the case of Japan, the introduction of diabetes testing as a standard of care was found to have a positive economic impact, $2,400 per year per patient, in saved productivity. And so expanding that value-based healthcare definition, not just to look at outcomes and costs within a health, but also look in the socioeconomic impact, is very critical to understand the value of specific interventions for overall society. So as a conclusion, as I mentioned before, one of the key three themes, it's very clear that there are two paths that could be taken. One where there's immense opportunity to leverage the full capability of the clinical laboratory and drive a better flow, a two-way flow, a multi-flow of information that takes better decisions in a way that impacts both patients as well as health systems. Or if the status quo is maintained, then changes will over time. 44% of executives surveyed believe they could outsource laboratory function in the future. 51% of healthcare professionals believe they'd like to have a choice of laboratory in the future. More than half of patients demonstrate a willingness to pay for additional amount. The point is the system's needs, the patient's needs are going to drive change. And either laboratories and those involved, and all stakeholders involved, could be part of the equation, or change will be imposed simply by need for the sustainability of health systems in the future. With that said, thank you for everybody's time, and I'm happy to take questions at this moment.
Thank you, David, for your informative presentation. We will now start the live Q&A portion of the webinar. If you have a question you'd like to ask, please do so now. Just click on the answer question box located on the far left of your screen. We'll answer as many of your questions as we have time for. So let's get started. Our first question is, what was the most surprising result from the research?
I think the most surprising result is the differences between the behaviors, perceptions, and overall actions that exist. Define in one hand an environment that really wants to enable the clinical laboratory and leverage all its data and insight. But really from a behavior, the day-to-day interaction healthcare professionals have with laboratories, as an example, really demonstrate that there's a gap between those set of beliefs and actions. And so that was really surprising for us to be able to see.
Our next question, were any significant differences found between countries in the current dynamics for labs?
So on one hand, you would expect to see a difference in behavior and systems between those emerging markets that face different healthcare challenges in a different stage of socioeconomic development. And so there was one graph earlier on that presented a higher level of unnecessary testing happening in markets, or perceived to happen in markets like Indonesia and China and Brazil. That is to be expected because those systems haven't driven as much efficiency from a cost perspective as you would have in other markets around the world. But it's actually very interesting to see the similarities even across different types of health systems, the changes and the issues that are faced in the UK versus the US versus other markets like Japan actually faced a lot of similar issues. A lack of alignment in terms of KPI management, a lack of data collection, the perception around healthcare professionals. And so the similarities are actually quite surprising across geographies, despite all the different differences that exist between those markets.
So David, what were the views of stakeholders around the trend towards outsourcing the lab function?
Again, it's interesting that on one hand, the stakeholders recognize the importance of integrating the laboratory as part of the overall healthcare ecosystem. But at the same time, executives and healthcare professionals and patients also want to have choice. I think part of that choice is a frustration with the system that simply isn't giving the information in a way that's timely and impactful and really generates a lot of confidence, particularly from patients and the other stakeholders involved. But there's a clear recognition that the outsourcing mechanism actually continues to drive that siloed secondary position as a cost center of the laboratory and not really enable all the valuable data insight the laboratory can play within the healthcare ecosystem.
Do models of success exist for the clinical laboratory, and what can be learned from them?
And there are wonderful models, and there were a few in the presentation, the Atlas of Variation, the cases in Vietnam and even Brazil. And there's pockets of these initiatives, and the study really gets into some of those cases in detail. But all those cases are pilot in nature, smaller initiatives that are occurring, trying to solve one element of the bigger picture. And so some of those models exist. I do think a bigger model of how do you generate a greater financial flow to an area that provides a lot of value, but can do that in a case where it only generates 5% of total healthcare spending. That's not sustainable. And I think that business model is the one where you need to see new successes in the future.
We are getting so many good questions in today, so I think we have time for a couple more. What is the single most important step all stakeholders can take to leverage the lab's full potential?
Well, there's a lot of steps that can be taken from a beginning level to be simply to engage and have the stakeholders be involved in setting KPIs and having transparency in measuring those KPIs. But I do think there's a bigger picture of trying to generate the evidence of what is the real value of the different types of tests and how that information really impacts the outcomes that matter for organizations. It's very clear that particularly executives understand patient satisfaction and hospitality mortality rate. Infections are great measures to be able to see, are you driving value or not for the system? How can you link that back to the work that the clinical laboratory does in presenting that evidence in a way that's refutable, and it really defines decisions and decision-making, particularly when choosing the different types of tests and who should be in the position to defining which tests should be used based on the patient need and the characteristics that we have. I think that's an area in which stakeholders can come together and really drive that evidence in a way that's dynamic, because over time we're going to learn more and what works well and what doesn't.
And it looks like we have time for one more question. For those in labs today, what is the key action point stemming from the research?
Well, there's two messages for the lab. A, the status quo and the model that occurs today is not sustainable. Certainly all the efficiencies that have been generated from the clinical laboratory, everybody within the healthcare ecosystem benefit from that. But that cost-driven model is certainly not sustainable, and it's not sustainable for the overall healthcare system. And so I think the real key message is to make sure that you're part of that broader healthcare ecosystem and understanding what are those KPIs and simply saying, we have a role to play other than just processing tests and doing that in a way that's efficient. That's certainly very important. But the more important thing is helping drive better healthcare decisions. And so starting to be involved in that process, simply understanding what is KPIs and starting to track them, being better aware of that, I think would be a good first step for those in that environment.
Thank you, David. Do you have any final comments for our audience?
I think my only final comment is beyond reading the study and get to know the research that was done, is that this is a really critical element and one that's not talked about in what has become a bit of a catchphrase in value-based healthcare. But the clinical laboratory holds all of this information that can be leveraged in a way that's powerful and impactful for health systems and patients alike. Then we need to figure out a way to enable both these systems as well as the individuals and the knowledge that exists within the clinical laboratory, because it's the insights. The data is one aspect, but the insights are as important as anything else. And so putting them in a more enabled role, I think, is very critical for all those involved. And we can't achieve the healthcare that we want without the laboratory playing a critical space.
Thank you again, David, for your time today and your important research. We would also like to thank LabRoots and our sponsor, Abbott, for underwriting today's educational webcast. Before we go, I'd like to thank the audience for joining us today and for their interesting questions. Questions we did not have time for today and those submitted during the on-demand period will be addressed by the speaker via the contact information you provided at time of the registration. This webcast will be available on demand through April of 2019. LabRoots will alert you via email when it's available for replay. We encourage you to share that email with your colleagues who may have missed today's live event. You will now be redirected to the Abbott website where you can download the white paper. Until next time, goodbye.